Hello, and welcome to Your Health Equity Matters. I'm Elgloria Harrison. I'm the Dean for the School of Health Science, Human Services, and Nursing. And I'm thrilled to launch this podcast where we explore health topics that matter to our community with a special focus on equity. Today, we're diving into potential changes to your health insurance and why this is important to all of us in the United States. And what does this really mean for our local communities? Some good news. More than 95% of New Yorkers have health insurance, which means about 5% of New Yorkers are uninsured. And in 2023, that was about 921,000 people. In 2022, according to NewYorkCity.gov, in the Bronx, 908,000 people have some form of health insurance, and that's really good news. I learned that New York has a plan called the Essential Plans, which provides low cost, affordable health insurance for New Yorkers. Oh, but that might be changing. To help us dive into today's topic, I am joined by Dr. Amy White, Assistant Professor in the Department of Health Equity Administration and Technology, and the Program Director for the Health Service Administration, major at Lehman College. Welcome, Dr. White,
Thank
to
you.
this episode of Your Health Equity Matters. Dr. White directs the Health Service Administration Program. She researches how access to health care services varies by insurance type, focusing on health equity and the disparities that disproportionately impact low-income residents in the Bronx. I'm so pleased that you are a trusted voice in this community to help us understand what might be changing by our health insurance. I want to say health insurance is very important. Without it, we don't oftentimes have continuity of our health care. So let's start this episode by talking about what is health insurance.
Health insurance helps pay for the cost of care. So the help to be insured means that someone else indemnifies you or takes on that risk. So the Affordable Care Act was enacted to help expand who has access to health insurance. And people's access to insurance depends on their age and depends on their income. So if you're under the age of 19, you can have Medicaid or you can have the Children's Health Insurance Program. If you are 19 to 64, you can have Medicaid. You can get that essential plan. You can get subsidies on your insurance through the marketplace, or you have private insurance that you get through work. And then there's also other government insurance if you are in the military. But there are lots of different ways to get health insurance, and depending on your age and your income, your insurance will vary. So in your insurance contracts with providers, contracts with hospitals, so you go where there's a contract. If you step outside the contract, your insurance doesn't work.
Well, so I know that you are pretty good. You're an expert in this whole notion of, having health insurance, and I shouldn't say expert. I'm calling you an expert.
Thank you. I
I'm
like a
calling
promotion.
you an expert. So I think it's really, it's not something that we really sit around a kitchen table and talk about, our health insurance. I recall, many years ago when I lost my dad back in the early 90s. And one of the things that I remember him always saying, "Oh, I don't want to use my health insurance." Now it could have been a function of the fact that he thought that by not using the health insurance was really a good thing. That we're sparing the government's money. By not using the insurance, things like that. And that was really to his detriment, and to all of us as a family, as to our detriment. It's so very important to have health insurance.
Yes.
Because health insurance helps to guarantee that we are able to get a provider that will actually be able to take care of us for, from now to, whenever we're not here and not needing our health insurance anymore. So let's just talk about, what is so important about having health insurance, And I know that one of the biggest fears that most people have is, what happens if I go to the doctor and then I get this big old bill
Yeah.
that says that I have to pay for this, the care that I'm receiving, and I don't have the money for that. Why
Yeah.
don't we talk a little bit about that? Because I think people really need to understand that process altogether.
It's scary because the bills are tremendous, and then you see things on the news about someone getting some crazy bill for a rabies shot out of state or
Mm-hmm.
something. Yes, so that's terrifying, and those stories are true.
Mm-hmm.
There are forces within each hospital. I'm going to call them a force because they are these magical care coordinators who see what you're eligible for. So they know how to sign someone up for emergency Medicaid if they're pregnant. They know how to sign someone up for emergency Medicare if they're going to be on disability, and not emergency, but to enroll in Medicare if it's
Mm-hmm.
time for them. So folks should not delay care for
Mm-hmm.
fear of that bill, provided there's cause for concern. And back to your dad not using his
Mm-hmm.
insurance. Health insurance doesn't work like any other form of insurance.
Mm-hmm.
If you get car insurance, middle-aged woman in the suburbs, I will pay a lower insurance rate than an urban young driver.
Mm-hmm.
I drive more. There's a wealth of data on me and how I drive versus some new driver.
Mm-hmm. Mm-hmm.
So my rates will be proportionate. Healthcare insurance is based on your age, it's based on your family size, and whether you smoke. So you're not charged for your risk level or whether you have a family history. You can't be denied benefits, and there's no maximum. It's that if you, God forbid, are hit by a bus and have some huge bill, and then something else happens to you, you're not going to max out your benefits. They exist for you. Whereas with car insurance or dental insurance, it doesn't function in the same way.
Oh,
So
okay.
there's a maximum to those benefits.
Oh,
That
okay.
you're not going to get a Porsche if you drive a Chevy.
Right,
So,
right.
but with healthcare, the insurance is there to treat what you need as long as it's medically necessary.
Okay. Why is it important that we should have established a primary care? We hear that word all the
Mhm.
time, a primary care physician or healthcare provider, because there are more than just physicians nowadays. There's
Yeah.
nurse practitioners that are actually able to see patients. There are physician assistants that are able to. Why is that so important? I mean, we have insurance,
Mhm.
and what is, like, what's the kind of the correlation between that?
The better access people have to care, the more reliable
Mm-hmm.
they have with their primary care physician. It's primary prevention. We identify and treat diseases and diagnose them earlier. The prognosis is better. It's less expensive
Mm-hmm.
for everyone, and the recovery time is better. So
Okay.
the better your relationship is with a primary care physician, it's the hub and spoke model. They can coordinate your care, ensure you don't get excess care, and ensure you see who needs to be seen. And
Okay.
they know you and they know your family history too.
And so, I think we all agree that preventive care is probably your best bet, right? Is to
Yes.
really, and that actually keeps the cost of insurance lower, right?
Yes.
Mm-hmm.
In countries that have universal health care or universal health insurance, people access primary care more reliably.
Mm-hmm.
Uh, all the data are better. Infant
Mm-hmm.
mortality, maternal mortality, life expectancy. The better the access to primary care, it correlates to better outcomes.
Okay. So I want to say this. I want to repeat this to our audience. One of the things that Dr. White and is really emphasizing is that if indeed you establish a routine time to go see your doctor every time, and that includes, perhaps if you are, able to get vaccination because of, the RSV season that's coming, the influenza season that's coming. These are the times to really be able to establish that kind of working relationship with your doctor, because that is so very important. Without and you have the benefit of really having the abilities, if you have insurance, to really be able to do that on a routine basis, and that actually wards off any challenges that you
Yeah.
have that become chronic, right?
Yep.
And so I think that is one message that we really want to say to our audience.
Super important because people can access care in many different places. You can
Yes.
go to urgent care, you can
Okay.
go to walk-in clinics,
Mm-hmm.
minute clinics, or whatever. But the relationship you have with your primary care provider helps establish a foundation for all of your health care.
Mm-hmm.
And that routine care, that the primary prevention, the annual visit, has no cost sharing. So you're not going to pay the copay on the annual wellness check.
Mm-hmm.
And going for that visit is probably the most important visit we can all make annually.
Mm-hmm. So that I've learned
Mhm.
something. I didn't know that New York had spent a lot of time thinking about the types of or insurance, or affordable insurance for a
Yeah.
lot of the New Yorkers here. And so talk about I learned about the essential plan. I
Yep.
didn't realize that there was such a thing as essential plan. And so that was really good news in a lot of ways, because I imagine that many, many people have access to that plan so that they are able to have actually better care.
Yeah, and they probably don't know because it's
Mm.
if you either fall below the poverty line and have Medicaid, or you get your benefits through work.
Okay.
And there's this vast middle of people that New York State has been more generous and better adept at accessing the middle. So gig economy people with multiple part-time jobs, if
Okay.
you don't get health insurance through work, you can qualify for the essential plan or for subsidies if you buy insurance through the marketplace.
Mm.
There depends on what your needs are and your family size. The essential plan has different tiers that similarly vary by your income level, but it's affordable health insurance for the people who don't get it through work and are above the poverty level.
Okay.
So the goal with all of this is to get people access to health insurance so that you don't have to bear the full cost of care.
Right.
Health insurance means you're not on the hook for the cost of the care, as long as what you're receiving is medically necessary
Right.
in network.
And I think that that's a really important piece. It has to be medically necessary.
Yeah.
Right. And that is one of the reasons why we go back to, if you establish a relationship with your primary care healthcare provider, then they can actually determine if it's medically necessary, right?
Yes. Yeah.
And then, so why is it that people are so scared about, going to the doctor and, not wanting to use, like my dad, not wanting to use their insurance? What is
Because so I've told you the story that I was brought to this field of health insurance my freshman year in college. In school, I'd been an athlete all my life, and I wasn't up for playing for any of my team sports at that level. So I tried out for where I played rugby, and I was not very good. I was C side, like A, B. I was C, and everybody fell on my arm, and I broke that and that, and I went to the hospital, and only later to find out that after I'd gotten to college, my dad had lost his job, and this is the early '90s, so there was no COBRA, there was no health insurance, and the bill for the ambulance and the cast was sitting on my father's desk, and that was a lot of money. That changed that opened up that opened up my eyes to the cost of health insurance, the value of health insurance, and defraying these costs, and making you not afraid to seek help when you need it. And now, I would have had coverage, and my goal with my research and with this field is to help people seek care when they need it, and to feel safe knowing that there's someone at the hospital who will help you sign up for benefits. There's ways to make the cost of care affordable and to not hesitate.
So health insurance is not a scary topic, you think? Because we all think, oh my goodness, it's, health insurance is such a scary topic, and it's not one that we really, really know much about. We only know what we hear on the news, what we hear. Now, I can tell you that the Affordable Care Act really, I think, made a huge difference in the United States in allowing lots of people to be able to access care that they would not have been able to access. And it's that was a good thing, and I'm hoping, and I think that perhaps many states did the same thing. They're like, oh, okay, if we can do it the United States, at the federal levels, perhaps we can
Hmm.
also do that at the state level.
Yeah.
So lots of our citizens should really be able to investigate, hey, there are ways of being able to cover my family. I
Hmm.
don't have to fear like losing my insurance.
Yeah.
And even if I did say lose my insurance, there are other mechanisms that
Yeah.
I need to investigate. Why don't we talk about what other things that people can investigate
Sure.
if indeed they're faced with the challenge that they might have lost their insurance?
Okay. So if you lose your job,
Hmm.
you can Cobra your insurance or buy insurance on the exchange.
Hmm.
So people who get insurance through work, their employer is paying about half the cost of their benefits, but it
Hmm.
varies. You don't actually know what they're paying unless you have to pay the full freight.
Hmm.
So it's very expensive to maintain your benefits after you lose your job if you try to keep the same
Hmm.
private benefits. Um, so the other option is to buy insurance on the exchange. And in class, we do things like this with our hands.
Hmm.
You can either do bronze, silver, gold, platinum, or
Hmm.
catastrophic benefits. And the difference in those benefits are cost sharing.
Hmm.
So if, your monthly payment will be low, your deductible will be high. And then you flip it.
Hmm.
So that's bronze. If you go to the platinum, then the deductible goes away, but your premium is sky high.
Oh,
So
okay.
the difference is between whether you're going to pay 40% and insurance covers 60, you pay 70 and they pay 30, 80, 20, 90, 10.
Okay.
That's the difference from bronze to
Gold, platinum.
platinum for the cost sharing. So it depends on your needs
Hmm.
and your family size and how long you're going to maintain those benefits. Um, there are care coordinators who can help you through those determinations. You can ask your doctor, who's in, see whether they're in network. You have choices. One of the beautiful things about living in New York, if you page through the marketplace, it's page upon page in the Bronx area. There are like 20 pages of options. If you just change counties, you don't have those options. It's amazing the competition in the marketplace. It's not inexpensive by any stretch of the imagination. Insurance is expensive because healthcare is expensive,
Hmm. Hmm.
but having insurance means you, at most you'd be responsible for 40% of the care.
Right, right.
So that 40% is better than 100.
Right. And so I think insurance also provides like a peace of mind, essentially,
Yes.
that I have it and that if something happens to me, that, at least I know that I actually am in a position as a individual or even with my family to be
Yeah.
able to get some kind of assistance, right,
Yep.
over the course of the time.
And it's capped. Sorry, excuse me. Like,
Mm-hmm.
you're not paying for 40% of all care. There is an out-of-pocket cap if
Mm-hmm.
something catastrophic happens. Even if you're in that bronze plan that you have a really high deductible, you'll be capped on how much you'll spend that year if something real bad happens.
I understand that there is a insurance just for children. So can you
Yep.
talk about that a little bit?
CHIP, Children's Health Insurance Program.
Mm-hmm.
So children are eligible for insurance that their parents might not be able to get.
Okay.
So parents qualify for Medicaid at 138% of the poverty level in New York, whereas CHIP is at close to 160%.
Mm-hmm. Mm-hmm.
So, and it's easier to enroll children than it is parents. For that, what you were talking about before, the primary prevention.
Mm-hmm.
Children are less expensive to insure.
Right.
We want them to be vaccinated. We want them to be healthy. We want to catch things early.
Right.
And so the government makes CHIP available and eligible more easily because we
Okay.
want
Okay.
to help children.
Okay. So so that's really good. So for families who may struggle,
Hmm.
at least if you have children in your families, those are options for
Yes.
you actually should want to investigate whether or not those things become available to you,
Hmm.
because you don't want your little ones to be uninsured at any point in their lives, because I think it's so very important.
Hmm.
And then there's one last one, and I think that's the military one.
Yes.
It has a lot of implications for a lot of military families
Hmm.
in the New York area, and so how does that work?
So if you're active military, you get
Mm-hmm.
TRICARE, and then Veterans VA. Um, that is not my area of expertise so much,
Yeah.
but it's you. It covers it's your HMO,
Mhm.
which is a health maintenance organization.
Right.
So with that hub and spoke model, that you have a primary care physician
Right,
who
right.
coordinates your access. They give you the prior authorization so that you can go seek the specialty care or what you need,
Mhm.
and preventing you from um, excess care, so to speak.
Right. I know that, I'm just, kind of pointing out my own personal relationship with not the VA. My sister is a
Mhm.
veterans, and my brother is also veterans, and they actually have access to the VA on a routine basis for
Mhm.
their care, and it also extends to their families. So
Yeah.
if indeed a member of the armed forces were, active duty, they actually have access to the care, and their families also have access to the care. And I'm told, from my sister and from my brother, that that care has been very, very good. Now they've,
It's good.
for the most part, been fairly healthy people,
Hmm.
and so that. But even when there was no, if they were not healthy, then there were times that that they actually had specialty care, and those specialty cares would allow them to be able to see a number of
Mhm.
doctors.
And it could be outside the VA.
Okay.
It'll cover the specialty in and out.
Okay. Okay. Well, good. So one of the things that we really want to make sure that our audience really understand, while we oftentimes don't sit around the table, the kitchen table, talking about our insurance, because it's just a thing over there that we really have to kind of think about. And we only think about it when it's necessary, like
Mm.
when it's, oh my goodness, they broke our arm. So now we are running to the hospital. And that's when we really think about health insurance. But it really is something that you should think about on a routine basis. Make sure that your health insurance is active.
Mhm.
Make sure that your health insurance is, accessible to you, so that when you are ready or need to go to a provider, whether it's a primary care doctor's office visit or whether it's the hospital that you have to go, that you actually know that your insurance is available to you, because that's very important. And particularly for families with little ones, we definitely want to make sure that all of those things are taken care of well before you ever need it. Things like, getting vaccination. So if you are, vaccination, again, I will say, is a voluntary effort on your part. But if you are interested and able to get vaccinated, make sure that your insurance covers that. Usually this is prevention,
Yep.
and usually preventive kinds of medicine is really covered by the insurance. The insurance company really wants you to be healthy. They don't want really to have to utilize all kinds of fundings to really be able to pay people for these catastrophic illnesses. They really want to make sure that it is all about prevention.
Mhm.
All right. So the one last thing that I want to say, we have talked about why it's so important that we keep up with our health insurance. Health insurance is not scary. We just need to be much more empowered in what it is. So I would even challenge everyone, go check out your, what I call those papers that they send with all those words on it, and read those papers because they are very important. Understand the kind of insurance that you have, whether it's a PPO, which is a preferred provider, or a provider,
Mhm.
preferred provider, whether it's an HMO, which is a health maintenance organization. Understand what they are saying to you in those documents that your coverage. Will they cover your prescription? So when you go to the CVS, will the CVS cover your prescription? Or will you need to buy extra for it to cover your prescription? I know that with Medicare, there's like four little levels. I'm certainly can attest to Medicare because I'm a member of that group now. I'm so pleased to believe that I'm a member
Congratulations.
of that group, that I am actually able to say, oh yes, I get my insurance through my employer. But some of us are retired and they're living a good life. And if they're utilizing Medicare, you might be using Medicare Part A. You might also have Part B. You might also have Part D, which is for prescription drugs. And
Mhm.
all of those kinds of things are really important. It's important for you to know all of those kinds of things. You see how I said, Part A, Part B, Part C. I think Part C is something about Medicare Advantage or
Yes.
something. And there's been a lot of conversation
Mhm.
across the United States about Medicare Part C. But there are advantages for all of those. What you really need to do is to really understand your own personal insurance and that it's not scary, and that the more you're empowered to know what, in fact, you are eligible for, you want to take advantage of that.
Mm.
Today, we explored health insurance and why it's so important to establish primary care providers, and whether or not that's your physician that you've been familiar with for many, many years, whether it's your nurse practitioner or your physician assistant, whoever it is that's taking care of you on a routine basis. Please make sure that you check in with them every year. And checking in means an annual evaluation every year, because that's very important. That's when we catch things, if we are able to do that every year. So, affordable health insurance in the state of New York, I'm hoping that doesn't change really soon. Yes, we'll knock on wood here. But affordable health care insurance is still available in New York. And so, if you are in between your jobs and you really need to make sure that you have insurance or that your families have insurance, please make sure you can follow up with that. And so, learning to advocate for ourselves is a really important thing. And that's one of the things that we are advocating right here, is that the information that we're providing you is really to help you to advocate for yourself. So now I want to thank my guest, Dr. Amy White, for sharing her insight and her expertise. Thank you for joining this episode of Your Health Equity Matters. Remember, if we have not covered something that you've been thinking about, please put it in the comment box below, and then we will get back to you and really help you to kind of process through some of these information. But until then, stay healthy, stay informed, and we'll see you next time. Thank you.